So finally, Isabella Lopez will present the use of a walk-in HIV and STI testing model for at youth age 13 to 24, assessment of the impact of the COVID-19 pandemic on the testing services, and she will doing this for UCSF Morsani College of Medicine.
Hello everyone, my name is Isabella Lopez and I am giving this presentation today on behalf of the Ybor Youth Clinic and the University of South Florida. Our presentation today is on the use of a walk-in HIV and STI testing model for youth ages 13 to 24, assessment of the impact of the COVID-19 pandemic on testing services. The University of South Florida Department of Pediatrics Ybor Youth Clinic serves youth from the ages of 13 to 24. Although it is university affiliated, it is operated as a storefront clinic in a high HIV and STI incidence area of Tampa. The clinic location was chosen to serve the large number of disenfranchised youth who frequent the neighborhoods surrounding it and was built to serve their needs. Services include HIV and STI testing and treatment, prevention services and counseling, sexual and reproductive health care, referrals to specialized care for physical and emotional trauma, and linkage to other youth programs in the community for other needs. Crucial to the clinic's success is its youth-friendly atmosphere and its ability to offer free walk-in HIV and STI testing. Evidence supports the concept of providing healthcare for youth in an environment tailored to them, while the ability to offer free walk-in testing provides flexibility and convenience. While our staff also does traditional outreach testing in normal times, our easily accessible free walk-in model encourages many youths to come to us at the clinic. This year's COVID-19 pandemic resulted in a switch from our normal walk-in testing to a call-in model with phone screening and assignment of a testing time slot within a day or two of the call. This change in service delivery provided a unique opportunity to evaluate the efficacy of both approaches to testing in our youth population and assess the effects of the pandemic on testing results. In 2017, we began development of a database to collect information to track the demographics of patients served by the YYC, how patients found out about the clinic, the type of service for which they came to the clinic, and services delivered. Over time, we have added information about social determinants of health and clinically relevant information on test results and time to treatment. For the current study, we extracted data from January 1, 2017 through September 31, 2020 to assess the number of walk-in visits by month, the number and type of both STI and HIV tests performed, and positivity rates for these tests. Our objectives were twofold. First, we reviewed trends in walk-in visits over the past 3 years to assess our delivery model and its utility in identifying STI and HIV infections in our target population. Second, we looked at the effect of the COVID-19 pandemic on our ability to continue to deliver services and on the positivity rates for infections in our patients. This graph depicts YYC services from 2017 through 2019. The information from 2017 shows patients' stated reasons for coming to the clinic, whereas in 2018, we began tracking actual services delivered. From 2017 to 2018, youth testing increased 72%, and from 2018 to 2019, another 23%, likely due to increased awareness of YYC services and an expansion of walk-in testing hours to accommodate increased demand. The fact that in 2019, approximately 50% of patients were repeat customers supports our youth-friendly approach. Over 70% of youth report that the YYC is their only place to receive health care, and less than 50% have health insurance confirming the need for our services. Additional data from 2019 showed YYC case-finding rates were 23% for bacterial STIs and 2.9% for syphilis. We also identified 9 out of 52 of the new HIV infections in Hillsborough County youth aged 13 to 24 through our walk-in testing. At the end of March and in April 2020, we modified services in response to COVID-19. Walk-in testing was discontinued and other services were cut back. All patients seeking services were instructed to call the clinic nurse manager. We instituted screening measures for patients coming to clinic, followed university recommendations for cleaning and PPE, minimized patient time in clinic, and switched appointments to telehealth when possible. Notifications were posted on the clinic door, on the clinic website, and on social media regarding these changes. By mid-April, modifications were in place that allowed the accommodation of all youth calling to schedule HIV or STI testing or request appointments. Patients were screened for COVID symptoms/exposures and assigned a time slot for their testing. The numbers designated as walk-in from April to September in the chart on the left reflect youth who called in for testing, while those in January, February, and early March depict traditional walk-in testing. Overall, average monthly clinic visits declined by 34%, from 215 to 135, from May to September compared to the first 2 months of 2020, with testing visits declining by almost 50%. This is a comparison of clinic testing in 2020 for the period before COVID, January and February, to the period from May to September after the clinic had made adjustments to its procedures in response to the pandemic. The numbers reflect averages for those time periods and include testing done at walk-in, designated time slots, and also at scheduled appointments when clinically indicated. Despite our ability to see all youth who scheduled appointments, STI testing decreased an average of 33%, while HIV testing decreased by 13%. The increase in syphilis testing reflects the fact that during this time period, we added a tester with phlebotomy certification, which facilitated more routine syphilis screening. The absolute number of diagnosed gonorrhea and chlamydia infections decreased along with the number of tests performed. This did not occur with the number of diagnosed syphilis cases due to the increased number of tests performed by the new tester. This chart shows case finding rates from May to September of this year compared to the rates in May to September of 2019. There was no statistical difference in rates for any of these infections in this analysis, and rates remained consistent with the diagnosis rates seen traditionally at the clinic. HIV diagnoses at the clinic are much less frequent, but 2 new cases occurred in the first 2 months of the new year, 1 in April and 4 from May through September. These numbers are in line with our historical averages. The walk-in testing model at the YYC is very effective based on the increasing number of tests performed and infections detected in the past 3 years. We demonstrated that increasing open access through walk-in testing increased the number of youth served. The COVID-19 pandemic resulted in a significant decrease in the number of patients for whom we were able to provide services. We increased the number of youth getting tested by switching to scheduled testing and reminder calls for appointments by the end of April. Although we can now accommodate all who call for testing, and most of them are showing up for their appointments, testing numbers remain below previous norms. It is unclear how much social distancing and decreased perceived risk for STIs has contributed to this drop in demand for testing, versus other reasons, such as the inconvenience of scheduled appointments, hesitancy to come to clinic because of the risk of COVID exposure, or diminished immediate importance of HIV and STI testing in the face of constant messaging regarding COVID. Continued monitoring services utilization and measuring behavior change during this pandemic will help us as providers adapt to the changing needs of youth and continue our efforts to prevent, diagnose, and treat STIs and HIV.